Good. Good afternoon, everyone, ladies and gentlemen. Good afternoon. You are welcome to this webinar that is being held by Reliance Supply Limited. And the topic for today is first aid update in COVID-19 pandemic. You're welcome to this beautiful session. We have beautiful speakers here that will have rich resources that I'm sure it will be worth your while. But before we start today, I would start by introducing myself. My name is Bolali Edwards, and I'm the founder of Strap and Safe Child Foundation. It's an NGO for children, just to keep them safe on the road, at school, and at home. So I'm here to support my sister and colleague in the safety corridors. So I enjoy you to please sit back, relax, soak in, enjoy this moment that we'll be sharing with these beautiful speakers here this afternoon. So I would talk about a bit of housekeeping here. And the housekeeping basically is about the things and the conduct that we need to observe whilst on this webinar till when we're done. The session is being recorded. We will let you know when it is available for replay. Please keep your microphone muted at all times, except when you are requested to speak. If you have any technical issues, please indicate in the chat room by raising up. I'm sure somebody will beckon on you there. So, questions should also be put in chat box in case you have some pointed questions for a speaker before the speaker is done with his session. Then please kindly participate in the poll and fill an evaluation form to let us know how we are doing so far. Okay?
Sorry.
I should actually have mine hand in there too. Okay. The objectives of this webinar basically is to make sure that by the end of the day, we can recall facts related to performing first aid in the COVID-19 pandemic, defend the introduction of first aid regulations in their respective organizations, explain the role of the first aider in the workplace. These are the questions that you'll be able to answer at the end of this session. And this is the agenda for today. So we have done the introduction and we will move on. I don't know if we'll have retired Major General Ogunbiyi online now. We have the first speaker, Major General Ogunbiyi, and he will be speaking on international protocols of CPR in COVID. Okay, we'll be speaking on international protocols on CPR in COVID-19 pandemic and safety of the first aider at an emergency scene. And our second speaker will be Mrs. Nofisat Arugundade. She will be giving us goodwill message and remarks on first aid regulations for organizations. And the third person would be Engineer Jamil Badmus, and he will be doing justice to emergency management in the workplace, the continued role of the first aider. And of course, our host for today and the person who is going to navigate us through will be the last but not the least, and she will be talking about first aid training in COVID-19 pandemic, and that will be Mrs. Fire Williams. So I will go on to introduce retired Major General Ogunbiyi right now, FWACS, FNA, MED, MNI. Major retired Dr. Obashin Ogunbiyi is a consultant at anesthetist and intensive care physician. He is a former Corps commander of the Nigerian Army Medical Corps. He was also an associate professor of anesthesia of the Kaduna State University, KASU, between 2014 and 2017. He is presently the president of Intensive and Critical Care Society of Nigeria, ICCN, SCCSN, I didn't get that, ICCSN, and member of Council of the World Federation of Intensive and Critical Care, WFICC, between 2017 and 2021. General Ogunbiyi is a member of the Court of Examiners of the Faculty of Anesthesia of both the National Postgraduate. Okay, Postgraduate Medical College of Nigeria and the West African College of Surgeons between 2002 till now. He was also a former member of the governing board of the National Postgraduate Medical College of Nigeria between 2009 and 2015. He's an avid professed author of 30 scientific articles published in local and international peer review medical journals. Is an invited speaker at the various local and international professional forums. Is a member of the editorial boards of African Journal of Anesthesia and Intensive Care, AJIC, and the Journal of Critical Care, JCrit Care, a listed and peer-reviewed journal published in the USA. In 2000, General Shina Ogunbiyi was a renowned Marquis Wu in medicine and healthcare in the world, published in the USA. Dr. Obashina Ogunbiyi, married with children, is widely traveled and is presently the coordinator of the critical care strategic pillar of the Lagos State of Nigerians EOC for the COVID-19 response. Help make welcome our first speaker for today, retired Major General Dr. Obashina Ogunbiyi. Please, you're welcome.
Thank you so very much, Mrs. Richards, for that wonderful introduction. I was wondering who was being introduced.
It's you.
Right. Can I share my screen now, please?
Yes, I've stopped sharing.
Okay. So you have about 10 minutes to do justice to this.
Yeah.
15 minutes, but less.
15 minutes.
You have 15 minutes, yes,
All
sir.
right, we'll do it.
Yes, sir. Okay,
Please, I need to share my screen. Right. First and foremost, I want to congratulate Rely Supplies Limited for hosting this year's World First Aid Day in form of this webinar. And I also want to congratulate each and every one of us on this forum for participating in this wonderful webinar, which I believe all of us have one thing or the other to learn from. My topic this morning is international protocols on CPR in COVID-19 pandemic and safety of a first aider at an emergency scene. As was introduced earlier on, my name remains Shina Ogunbiyi MNI, and I'm presently the coordinator, Critical Care Strategic Unit, Lagos State EOC for COVID-19 response. I'd like to make some few definitions. First aid is the immediate assistance provided to a sick or injured person until professional help arrives. This itself is an act of saving a life and is the series of actions that a first responder to a patient that has cardiac arrest from whatever cause carries out as quickly as possible. 2 or 3 main keywords here is that when you carry out a first aid, you are saving a life. That's one. And also, it's a series of action that the first responder carries out on this patient. And thirdly, it must be done as quickly as possible. Cardiac arrest, on the other hand, is the sudden cessation of cardiac activity in a person not expected to develop such. The next question is, what is the importance of CPR, which is cardiopulmonary resuscitation? It's good to recognize cardiac arrest, treat it, and prevent injuries in the patient. And the various elements of the cardiopulmonary resuscitation, for all of us who are well versed in CPR as first aiders, is the conventional ABCD, which when we were growing up in our basic life support was airway, maintaining airway, clearing and making sure that the breathing is adequate for the patient, then maintaining a good circulation in the patient, And D there is for defibrillation. If a patient may need to be defibrillated, you apply defibrillation. This is the order, that's the ABCD that we used to know it. However, this order has been changed in view of recent indices to ABDC. That is, the defibrillation comes quite early in the scheme of CPR now. So we are having ABDC now. It's because early defibrillation has been found out to improve outcomes. What is the outcome in this patient that have cardiac arrest? You want to resuscitate them and bring them back to life. And early defibrillation has been found out to improve this. In actual fact, sometimes if a trained responder arrives at a scene of cardiac arrest early enough, and the first thing he does is to defibrillate the patient, it's been found out that there's a 35% or thereabout chance of this patient surviving the cardiac arrest. The authority which we rely on for these guidelines is the International First Aid and Resuscitation Guidelines 2016. This guideline is that we rely on is the International First Aid and Resuscitation Guidelines 2016. This guideline is reviewed every 5 years. In other words, the next review of this will be in 2023. Hopefully, the incidents of this year, which is the COVID-19 pandemic, will be part of the things that will be taken into consideration when this guideline is reviewed. Next, let us quickly avail ourselves of the COVID-19 story. The coronavirus disease, otherwise known as COVID-19, is an infectious disease which is caused by a new strain of coronavirus that had not been previously identified in humans. On 31st December 2019, in Wuhan, China, they found out a cluster of 27 cases of pneumonia of unknown origin, and this was reported to the World Health Organization. The WHO declared this viral pneumonia as an outbreak on 30th January 2020. And by 11th of February 2020, the WHO named it the novel coronavirus, otherwise known as COVID-19. With us in Nigeria, our index case was discovered or confirmed on 27th of February 2020. And this was in a 44-year-old Italian that came in from Milan in Italy to Nigeria 2 days earlier and had all the signs and symptoms of the COVID-19. This index case in Lagos happened to be the third confirmed case in Africa. The first confirmed case in Africa was actually in Egypt earlier on in February. It's important for us to know that the WHO also declared COVID-19 a pandemic on 11th March 2020 due to the global logarithmic expansion of the cases. As at date, the total confirmed cases globally, as at last night, was 28,199,791 cases, and 910 and 78 deaths globally have been confirmed. Also, in Nigeria, as at yesterday, 11 September 2020, we have 56,017 confirmed cases, and we have recorded 1,076 deaths so far. So let's go to the meat of this presentation then, which is CPR during COVID-19 pandemic. There are some questions which I raised in terms of this CPR during this COVID-19 pandemic. As I mentioned earlier on, I'm sure by the time the guideline 2016 is reviewed, it will take into consideration some of the things we are talking about today. The questions stands around safety and transmission of the virus. Safety is that of the first responder, the casualty himself or herself, and others around, and it's very, very important. Transmission on its own involves preventing or minimizing of risks of transmission. The COVID-19 situation is rapidly evolving, and the clinicians are battling to further discover its pathogenesis with a view to discovering a cure for it or get a suitable vaccine against it. If a heart stops, a bystander is at liberty either to perform or not to perform mouth-to-mouth breaths. This is one of the things which has come to play in this COVID-19 pandemic. In other words, if I feel strongly that could this patient be infected with COVID-19 or not, in that case, I may not go ahead to do mouth-to-mouth breaths. This is allowed. It's purely allowed at this time of the COVID-19 pandemic. Also, the American Heart Association guidelines to CPR during COVID-19 patients is designed, among other things, designed to help health systems and providers to mitigate the risk of COVID-19 infectivity while maintaining the survival gains of cardiac arrest. There are some principles I will just quickly mention as I'm passing on now. This is for principle of CPR for COVID-19 pandemic patients. First, which is very important, you have to minimize provider exposure. Remember, I spoke about the safety earlier on and transmission of the virus to the responder. You want to reduce healthcare worker infectivity and mobility as much as possible. Also, if it is possible, all healthcare workers who are going to take part in this resuscitation, they are to don the appropriate PPE before entering the scene. That's before coming to the scene of the cardiac arrest. However, we all know that we talk about bystander CPR these days, and we don't carry PPEs alone. Even in the hospitals itself, PPEs are rare to come by, as it were, globally, not only in Nigeria, but globally. Rescuers should therefore consider wearing minimal PPE, which is a face mask and gloves. And it's also good to place a face cover or a face mask over the face of the casualty. If you don't readily have a face mask, you can put a face cover just over the patient, as it were. Also, personnel on the scene should be limited to only those essential for patient care. If you don't know how to do a bystander CPR, if you are not armed enough with the minimal PPE, you have no reason to take part in the patient care at that time. This is very, very important. We know, we Nigerians especially, we are so empathic, and we may want to rush to go and do resuscitation in this patient. This brings me to remembrance of an incident that was watched on national TV some time ago, where somebody who was talking on behalf of his organization suddenly collapsed on the table, and you saw how people rushed to him. Of course, they did not know what to do as at that time. And almost 2 or 3 of those that went there were not even wearing face masks at all. Or one that was wearing his face mask was slacked down to the chin. I have it on good authority that at least 1 or 2 of those people who rushed in at that time, on that day, that were present in that place on that day, later went on to develop COVID-19 symptoms. Also, it's important to remove and dispose of any PPE at the end of the resuscitation. What I'm saying there is, if it's the minimal PPE, which is the face mask and the gloves which you use for the resuscitation of the patient, please, it's good to dispose of these items at the end of that resuscitation. Next, I will quickly go on to giving nuggets for performing CPR in a COVID-19 patient. 1, assume that any casualty has COVID-19 because it's possible for him to be completely asymptomatic. And as we are quite aware, over 65% of those who have COVID-19 patients have been found to either be asymptomatic at all, all the same, or mild symptoms of COVID-19. So always assume that every patient that needs CPR at this time, in this season, has COVID-19. As mentioned earlier on, consider use of PPE whenever possible. This is minimal PPE. And don't forget to always call the emergency medical services or call an ambulance. We have 212, we have 767 that we can readily call on as soon as possible in Lagos or in Nigeria, as the case may be. Also, CPR with breath is reserved for people trained in CPR. It's not for every Jack and Harry. But as I mentioned earlier on, you can actually decide not to do the mouth-to-mouth breathing if you are not trained and if you don't really want to do that. In this case. If however you decide to perform breaths, please, it's good to use a barrier device, e.g. pocket mask, to protect yourself. Also, it's important to cover the patient's mouth and nose with a towel or a clothing, or even the disposable non-surgical mask may be worn by the patient. This, of course, is to prevent potential spread of the virus. And also, I want to say that if you don't want to do mouth-to-mouth breathing, you are free to continue to perform hands-only CPR with a compression rate of 100 to 120 per minute to a depth of 5 centimeters. Not more than 5 centimeters, because if you go more than that, you are liable to break the patient's ribs and cause other damage worse than the cause of the cardiac arrest. Also, you should prepare to self-isolate and follow the national guidelines if you develop COVID-19 symptoms, if you recently attempted CPR in any patient whatsoever. Now, next I'll quickly run through the personal safety of first aid responders. When the first aid is provided, the safety of the first aider should be considered at all times. And while saying this, self-protection is very important before, during, and after the emergency situation. Before the emergency, it's good for you to get relevant information about the risks and take preventive measures of the environment. Also, during the emergency itself, when you are doing the CPR or first aid, as the case may be, you can do first aid in several situations. Poison, trauma, cardiac arrest. These are situations that demand first aid. During the emergency situation, you must self-protect from immediate consequences and any further accidents. Post-emergency, after you have finished with the resuscitation, always obtain adequate assistance in terms of water, food, and even shelter. And it's important, I want to specify this, it's important to have your psychological and emotional need restored. A lot of people who are involved in this situation, somehow or the other, they tend to want to remember the casualty, the incident, and sometimes they may need mental attention in terms of psychological attention. Also, I put here lessons learned. It's good for us as first aiders to always look back, to always read about incidents and what happened, what transpired in the course of the first aid, and note the lessons that are learned, as it were, in such incidents. I want to specify here that it's very important that self-protection of the first aider should be taken into consideration. That's the personal safety, which is what we're talking about here. Also, again, at this time, it's good for us to take personal responsibility, especially for as first aiders in this COVID-19 pandemic situation. What you do, how you live, it's your own personal responsibility. Why am I saying this? It is important for us to use our face masks at all times, and also to do the measures, the public health safety measures that we all know, wash our hands regularly, and so on and so forth. The important considerations for personal safety in this case is overall and distinct safety. Are you trained to give care in that risk area? For instance, If you go to the beach and you have a casualty that got drowned, are you trained in giving care to a drowned person? Do you know what to do at that situation? Is very, very important as a first aider. Also, it's good to always remove the casualty to a safer area for care. I had one scene at the Old Bar Beach. I had one scene a casualty that drowned, and a so-called first responder ran to him while in the place there, and he wanted to start resuscitating where the water pushed him out instead of moving out the patient to a safe area. Some of us that know what to do the first thing we did was to grab the patient out of his hands, push him aside, and called others to help us move the casualty to a safe area. This is very, very important.